Hi, my name is Bilal Talha, and I'm doing this presentation today for the 855 course of Community Medicine and seminar. So I chose the topic coronavirus because I figured it was very relevant in today's world as far as what's going on. So just gonna start. That's just a pretty morphological picture of the coronavirus. Just a class of coronaviruses, what they exhibit, the proteins on the structure. I'm just gonna start with a little background. So currently, it's an epidemic, which is fast turning into a pandemic. If you were to go back, you can find the first time it was reported was December 31st of 2019. But if you actually follow the literature back, the first reported case was around the beginning of December. And so initially they called it pneumonia of unknown origin because they did the tests, flu negative and strep negative, all the other upper respiratory tract symptoms, they all were negative. So etiology was initially attributed to a novel virus belonging to a coronavirus family. So currently they're calling it COVID-19, which stands for coronavirus disease 2019. But the taxonomical groups got together. They're currently changing the name from COVID-19 to SARS coronavirus 2. The reason they're doing that is because it's about 80, when they look at the genetic composition of the virus, it's about 89% similar to the SARS epidemic that happened back in 2002 and 2003. And I think it's about 82% similar to the MERS, which is a Middle Eastern respiratory virus, which happened in 2012 in Saudi. So I just want to take a little step further and go into a little epidemiology of it. So as far as I mean, the latest is March 3rd. This is where these numbers are from. There have been about 87,137 confirmed cases worldwide since the beginning. And out of these 87,137 cases, around 3,000 have been fatal, which turns out to be around a 3.42%. It might look significant, but flu is around 1%, the fatality rate of that. So 92% of these cases are actually recorded in China, which is where the whole thing started, and which is where almost all the deaths also occurred, which is around 96.5, 97%. Since the epidemic, the SARS coronavirus 2, which is the current epidemic, it has spread to 59 other countries. And outside of the 87,000 cases, there are 7,169 cases. And some of the countries, major countries, I would say, or Italy, Iran, Japan, Singapore, U.S., France. There's a few more cases now happening in Asia. India has like 3 cases. Pakistan has like 4 cases. So it's quickly becoming a pandemic at this point. And WHO has actually called it a pandemic. So this is a little map that I found online. This is basically, the red is all the areas where the confirmed cases of corona are around the world. So, there's some in, US, Canada, there's some France, Germany, and then this is Asia over here, and India, Nepal, Thailand, China mostly. And yeah, so transmission. So the first cases of coronavirus were actually linked to direct exposure from the seafood wholesale market. The name was Huanin. So that was the first thing, and everyone thought that it was an animal to human transmission. So initially, animal human transmission was considered the only mechanism of transmission, but there have been multiple cases since then, and for human to human transmission. A few cases of actually fecal oral transmission have also been recorded recently. So, like any other upper respiratory tract infection, it's believed that it's going to spread in human to human through respiratory droplets, which would be coughing, which would be sneezing, and aerosol transmission is also a possible mechanism. Just because there's so much unknown about this virus, they're just being very, very careful about how this could actually be spreading. So they're also calling aerosol transmission as a possible mechanism. Just a picture of someone coughing, so just maybe that sticks. Um, so a little bit more. So the incubation time of this virus is, I mean, so far according to the research, it's about 3 to 7 days, but it can go as long as 2 weeks. And so the basic reproduction number, which is actually R naught, and it's basically what it means is that one person who's infected with coronavirus can spread it to 2.2 other people. So if you were to compare it to like the SARS epidemic back in 2002 and 3, it was the R naught number was 3.0. So it was actually much worse than the coronavirus that's happening today. So a little signs and symptoms. So the clinical spectrum of the coronavirus, it varies from, completely asymptomatic to some conditions, normal flu-like symptoms like fever, malaise, dry cough, dyspnea, and diarrhea. You can also have pneumonia, which is actually the first case. That's why they labeled it pneumonia of unknown origin. And it can get as worse as, respiratory failure, multi-organ failure, sepsis, septic shock, and pretty much anything that can, get you to death. So because there's no current treatment going on, so the only thing is supportive measures. So that's what you can do. So respiratory failure, more if someone actually gets into respiratory failure, they're probably going to need mechanical ventilation, and they probably need to be admitted to ICU. So the only fear these days is that because there are so many cases popping up, the hospitals are actually concerned that there might not be enough ventilators or ICU beds available in the U.S. if it actually becomes that widespread in the U.S. So, in order to diagnose initially, in the presence of symptoms, it's important to. So that's what WHO recommends, that you have to make sure that flu is not causing these things, because they're very similar symptoms. Cough, a little bit of fever. Someone might be complaining of sore throat. Strep presents in a very similar way, or any other rhinovirus, or whatever else you might call it. They present similar ways. So you have to make sure that you're not overdiagnosing someone mm, with coronavirus when it's probably just flu. So if there's any suspected case, WHO is recommending that you collect specimens from both upper and lower respiratory tract. By what I mean by that is, upper respiratory tract is, just taking an oral swab or like a nasal swab versus like a bronchoalveolar lavage. Most people are not going to do it, the BAL. The only time you would do that is if someone is actually intubated, and it's easier to collect that. Besides that, expectorated sputum is enough to diagnose. And the actual test that they're doing is a reverse transcriptase PCR, polymerase chain reaction, and they're using nucleic acid amplification test also. I figured I'll just put a little diagram of how PCR works. I don't think I need to go in much detail, but because coronavirus is a single-stranded RNA, so what it does is it takes the RNA and it matches a complementary strand, so it turns into double-stranded DNA. And from there, it can just increase it, and that way you can identify what's actually going on with the patient. And so the higher risk groups, males have a little bit of a higher predilection, about 56%. I don't think that's significant. So I would say about 50-50 males to female ratio. So the patient's median age is actually around 59 years of age, but the range is from age of 15 to all the way to 89. And the fatality rate, if you were to break that down, turns out to be, 15% of the people who are more than 80 years of age, 70 to 79% 8% fatality rate in there, and any 49% of the people who are actually dying are because of any other comorbid conditions. That could be heart disease, they could have diabetes going on, they could have respiratory disease, because either obstructive or restrictive, they could have an oncological condition. So prevention strategies, in order to prevent more cases from developing, WHO is recommending to use droplet precautions, airborne precautions, which would be an N95 or an FFP3 mask, contact precautions, which would be gowns, eye protection, gloves. WHO is also recommending to avoid close contact with the subjects with any respiratory symptoms. You have to wash your hands frequently, and then unprotected contact with farms or wild animals should also be avoided as much as possible. And especially for people who are immunocompromised, it's recommended to just avoid public gatherings as much as possible, because the mortality is just about 49%. It's just really high. And using hand sanitizer, I understand that the prices have gone through the roof because everyone's just getting hand sanitizers. And just, I mean, if you have it, use it. Otherwise, washing hands, I think, is enough. And I just figured I'll just put a little picture all the way on the left. That is an FFP3 mask, which is an airborne precaution, an N95 mask, which you probably see a lot in hospitals, and just a normal mask, a surgical mask that you would wear when you're, that would just prevent you from droplet precautions, like in a surgery or something. So treatment and management is very similar. There's no really any antiviral available currently, although US, China, and Australia are actually working on some trials. So someone who has confirmed diagnosis, oxygen is the first line therapy, non-invasive ventilation, that is. So someone who's not responding, then respiratory failure, they're going into respiratory failure, you put them on mechanical ventilation. And someone in septic shock, you give them hemodynamic support, which is IV fluids, and whatever else you might need to give. No, special attention needs to be paid when you're actually intubating patients. You have to use personal protective equipment. Make sure you have gloves on. There's no air droplets going from that person that you're intubating to yourself. And also they say that rapid sequence intubation is preferred because it's quicker. You don't have to use paralytics and all that. So that's about it.